problem with acne is not the acne itself, because the acne is honestly going to go. In most cases, it's going to heal on its own. It may take a little longer, but it's going to go away. The problem I have with acne is what it leaves behind. The post-acne pigmentation, the post-acne erythema, the scars, all of it. And by far, the scars are the worst. I'm Dr. Tanvi Vaidya, I'm a consultant dermatologist, and we're going to be talking about what acne leaves behind and how you can fix it. So let's get started. Now, broadly, what happens when you get acne is there's a lot of inflammation, the acne bursts. If you burst it, it's even more inflammation, so even more sequelae. Essentially, when there is inflammation, what's going to happen is two things. One is a lot of redness, so post-acne erythema, which is those red spots that you get after acne. Two is post-acne pigmentation, which is the dark spots that you get, brown spots or black spots. Why does that happen? Because when your acne is healing, when there's inflammation, the melanocytes, which are pigment-producing cells in your skin, simply freak out and they go, and they're going to leave a lot of melanin and they're going to deposit all that melanin in your skin. That's literally what's happening. That's called post-acne pigmentation. Third thing that's happening is, to facilitate healing, your body is going to now deposit collagen in any random haphazard manner. Normally, collagen fibers are parallel to each other in a very well-patterned distribution under the surface of your skin. As soon as there is acne haphazard distribution, and there will also be vertical collagen fibers which are now pulling your skin down, which is why you're getting these atrophic acne scars, which are the khaddas that you see post-acne. Of course, there are also hypertrophic acne scars, very rarely, which are raised over the surface of your skin, which are treated by a CT laser, which we'll get into also in due course of time. But let's break this down and talk about how you can go about treating all of these conditions one by one. Now, first of all, the most important thing is to prevent the formation of these scars. What can you do? One is sun protection, so less inflammation. Two is stop picking at your acne, stop trying to pop them. Whether in a parlor, whether by yourself, stop trying to pop your acne, number one. Okay? So these are the two main things that you need to follow. Wear sunscreen, don't pick at your acne. Third thing is to prevent new acne from forming. I always keep telling people this, that there's no point fixing your scars, there's no point fixing your post-acne marks if you're going to get new ones. So you also need to be on a good skincare routine. You need medication to prevent new acne from happening. So you need to definitely get on that. I have a separate video talking about how to deal with acne, which you can watch. I'm linking it here. Or you can of course consult a dermatologist and get your acne fixed first. Then we're going to be talking about how to deal with your post-acne erythema first, which is the redness. Some very good ingredients that you can use to fix your post-acne erythema are OTC products. Of course, there's azelaic acid, which is what you can do on your own. If you, of course, consult a dermatologist, they might also give you some ingredients like a brimonidine, which helps to reduce the blood vessel dilatation, which causes the redness. There's also tacrolimus, which reduces the inflammation. These are great ingredients that work on that post-acne redness. You can use azelaic acid OTC. Next, coming to post-acne pigmentation, which is the brown spots or the blackish spots that develop. For that, again, azelaic acid is a wonderful ingredient, along with other things like tranexamic acid, kojic acid, glycolic acid, licorice. All of these things help to depigment your skin. Hydroquinone also works really well, but again, is a prescription grade product. So you're not using that on your own. Next thing to do while you're doing all of this is to keep your skin well moisturized, because all of these are going to exfoliate your skin. Dry skin is not going to heal well. So you have to keep moisturizing. You have to keep using sunscreen in the day. Coming to procedures that work for post-acne erythema as well as post-acne pigmentation is chemical peels. Laser toning is one of my most favorite things to do because it also treats active acne, particularly carbon laser toning. And just general laser toning helps to get rid of any pigment beautifully. There's microneedling with tranexamic acid, which also works extremely well on these acne sequelae. Next, coming to acne scarring. So there's two types of scars. Scars can be hypertrophic, which is above the surface of the skin, and atrophic, which is under the surface of the skin. So we talk about a khadda. When we talk about hypertrophic scars, the best thing you can do is intralesional steroid injections, radiofrequency ablation, or a CO2 laser is one of the best things you can do if you have hypertrophic scars. But of course, these are rarer. If you have atrophic scars, which are far more, there are various procedures that you can consider. The only topicals that honestly can work and make any amount of difference for acne scars is retinoids, okay? But even those will make about 5 to 10% of a difference. It's not going to get rid of the scars in time. When we talk about procedural therapies, we can achieve an 80% reduction in the depth of your scars. So it's a significant enough reduction. Will it go 100%? Probably not. If anyone's telling you that they're going to magically fix your acne scars and get rid of them entirely, they're probably lying. So what are the procedures? It depends on the kind of scars. There are some scars which are ice pick like this. There are some which are rolling, which are sort of like saucer shape. And there's box scars which are sort of punched out. They have sharp edges at this side. Now for all of these, there are different kind of procedures that work. If there are ice pick scars, we do something called a TCA cross, which is a strong chemical peel which we literally apply with a toothpick into that ice pick scar. Really helps to lift that out. The only problem with that is it's quite a strong peel, so there's a little bit of whitish cast that happens initially. It then heals, it may peel off, it may get a little blackish, it may leave a little bit of pigmented residue on your skin, but that will go away in a month or two at best. But TCA is what works extremely well for ice pick scars. When coming to box scar and rolling scars, we do something called an MNRF or a CO2 laser or an erbium YAG laser. All of these, what they're doing is essentially they're helping to resurface the skin. There's normal new collagen that is going to be produced under the surface of your scars, so it's gradually going to start lifting off with each sitting. Usually it takes about 4 to 6 sittings of any of these treatments to see that good 80% reduction in your scars. There are also some other procedures that we can consider doing, like subcision. I combine subcision with the radio frequency. So we literally insert a needle under the surface of the scar and we move it around, of course under local anesthesia. So we move it around the surface and you actually hear those collagen bands sort of breaking. So you hear a cut sound as we do your subcision, which is those collagen bands which are pulling your skin down are breaking. And then we are encouraging the formation of new collagen. This is also why we also can sometimes club PRP into your treatment. So we do a PRP or a PRF, which is a concentration of growth factors which enables the formation of new normal collagen so your skin can lift up. We also do skin boosters, or we subsize, and sometimes we can inject autologous fat. There's a lot of different treatments available that you can work on your acne scars, but of course one size doesn't fit all, so you definitely need to talk to your dermatologist and figure out what's the right choice for your scars individually. I hope this video helps. I hope I've answered a lot of your questions. I hope you can deal with the sequelae of your acne better. I hope you stop popping your pimples. If you have any questions, please ask me in the comments. If you have any suggestions on what more content you'd like to see, please let me know in the comments again. Of course, subscribe, like, share, do the drill. Bye-bye.